I'm Dr. Bone.
I'm Dr. Tartaglia.
Tell me about what is a healthcare surrogate and why is that so important?
Well, a healthcare surrogate is someone that a patient will designate to take care of their well being when they no longer have capacity to handle their well being.
Is it my money?
No, it's not your money, it's your choices.
What choices?
Your choices of how you want to end your life and what you would like it to look like at the end of life. Not really ending life, that sounds very traumatic, but what it means is when you are sick, or even before you're sick, it's good to know what your wishes are when you do get sick.
Well, how would I choose someone?
My suggestion is to choose someone that is like-minded, like yourself, someone that you know will be strong enough to follow your wishes, because when you're really sick and you're not able to have capacity to make those just choices on your own, you have to make sure that person's going to stand by you, because it's really hard when you're not well and you're unable to make decisions.
She just used a word I want to ask about. What is capacity? When you say capacity and I no longer have capacity, what if I can communicate with you with winks or blinks or smiles or frowns, or, I can shake my head or nod my head and give you a thumbs up, an index finger, or I can give you a middle finger? What happens if I can still kind of communicate? Is that what capacity is?
Well, if you can still kind of communicate, we can look at that as to help in the decision-making process. But what this healthcare surrogate does is, prior to you getting sick, is you set everything up with them and you know what your wishes are. Now, obviously, if you're in the ICU and you still can give a thumbs up, I've had patients be able to write on boards, and we did honor that. It would help the healthcare surrogate go ahead with the decision-making process.
So what if I have like a memory impairment problem and I understand that I am sick, but I don't understand the date, I'm not really sure who I'm married to anymore? Do I still have that ability to make those kinds of complicated medical decisions?
Well, it's really up to your healthcare team to determine if they feel that you can make those decisions, and it just is really dependent. There are a lot of patients that I find that have memory impairment, and they know from day one that they do not want to be in a hospital, they do not want to have a ventilator, and that's something that they hold on to. And then we have some memory impairment patients that unfortunately don't have the ability to hold on to those.
So it's not a money thing, it's a medical decision thing, and that person, that surrogate, only makes those decisions for me when I can no longer understand my surroundings.
Correct.
To choose a surrogate, it would probably be important for me to talk to that person about what quality of life means to me before I reach that point.
Absolutely. It's so important to discuss your quality of life and what you would like that to look like before you're to get sick. I always tell my patients, I myself have a living will, and I'm a healthy 48-year-old. Now, if something should happen, I would hope that my family would honor my wishes just as a 48-year-old, as a 70-something-year-old, because if I'm really sick and terminally ill, I don't want to be sustained on life-saving measures.
I think that's an important distinction, that it is the choice of the person to get to choose for themselves, but it is the responsibility of the healthcare surrogate to be able to be that voice if there is a time when the patient no longer has that capability to communicate that. For me, living is about being able to be, being able to do, being able to communicate, and not just being sustained on a machine and being alive. My kids have known that for many years since they were very young, that my choice would be, if I cannot communicate, I don't want to be sustained on a machine. And they reassured me that they would unplug my ventilator to charge their cell phone. So I think that that's important for that kind of communication and dialogue to go on, and to not be a one-time communication. Have you found that, that's an ongoing dialogue that's difficult for families to communicate about?
Yeah, it's a very difficult, when you think about your mortality, right? People do think that they're going to live forever, and they don't want to see themselves as sick. So I find it's something that you have to continually speak about over and over again to try to help families even understand what they really, really, truly want. And then also, as they are sicker, sometimes things change, right? They decide that, they're living less than and they're okay with it. So maybe they'll modify their wishes.
In my clinical experience, I like to bring this topic up with patients whenever there's been a change, a new diagnosis, another admission, a decline. When there's been some sort of health event, I like to stimulate that conversation. I don't think they need to talk about it every day, but I do think that it's a topic that's important for them to communicate to their families. And I like to stress to the surrogate that yes, it is a very difficult job that you have ahead of you if you're asked to be a surrogate, but your responsibility to that loved one is to say what they would want if they could speak now. So sometimes you feel like, this is my loved one and I really want them to be here with me. I want them to be strong. They're always a fighter. I want them to go on and carry on and continue this battle. But in my experience, sometimes patients become weary of the fight and they just want the family to encourage them and to support their decision. Have you noticed that in your clinical experience?
Oh, yeah, I think it's a big part. Oftentimes, we'll speak to our patients, and our patients understand, right, that they're very sick because they're going through the process. They're getting weaker, they're not able to do their normal activities, and they're not really able to enjoy life because they're symptom burning. What I mean by that is they have symptoms like shortness of breath or chest pain, and they're not able to maybe even walk outside to sit on their patio. So they have a hard time reiterating that to family because then families perceive it as giving up, right?
So let's talk about symptom burden. You brought up that the patient now feels like their burden has grown and they're not able to do the things that bring them pleasure.
Right. So what I find is when the symptoms outweigh their living, that's when patients really start to understand their disease process.
And is that something that you decide or the family decides? Who decides about the burden?
I think the burden should be decided by the patient. Oftentimes they are the missing piece, and this is why we have our channel, because I think it's really important that we remember the patient, because it's easy for us that are healthy and able to do normal activities to just keep pushing the patient and not saying, oh, you're giving up, don't give up. I always go back to the symptoms that we're managing and how we can try to work better to give them better quality of life with the life that they have left, and then reiterate what they've already left behind, which is they're living well and what their wishes are.
Right. I have to agree with that. I found that giving up phrase can be very wounding for a patient because they have been the ones that have endured the health crisis. They have been the ones that have gone through all of the different modalities of care, have had all the tests, have heard all the bad news, and it affects them. And so I found that sometimes patients have been very reluctant to tell their families what the healthcare team has shared with them about the forecast, about the prognosis, because they're fearful that the family is going to come at them and say, you're a fighter, you're strong, don't give up. And that is really wounding to them.
This week I had a patient, I work mostly remote, but I look at patients, diseases on computer. So when I look at patients on paper, I have a vision on my mind of how they are. And I have a patient that keeps going in and out of the hospital, and we couldn't really figure out what was happening. When I looked at the medical records, the patient has metastatic disease. So when we spoke to the daughter, because the patient's in the hospital trying to figure it out, she said, I had no idea mom's disease was this advanced. My mom stopped letting me go to appointments. So basically the patient was very smart in a way. She didn't want the family to know how sick she was. So now the woman is in the ICU. She doesn't have her wishes out there. They're not verbalized. They're not in writing. And unfortunately does not have capacity now.
Wow.
So it's going to be very tough on the family.
Choosing a surrogate, I think, in my clinical experience, is so important to have that set up way far in advance. And then it needs to be an ongoing communication, maybe not necessarily a dialogue, but you as the surrogate need to observe how this individual has lived their life and what kind of choices they've made to be important for their quality of life.
Mhm.
And as the patient, I think it would be really nice for the patient to communicate with that surrogate at some point in time and let them know, you are my surrogate, and
Mhm.
this is what's happening in my health. And
Exactly.
these are the decisions that I've made in the past, and they're the same, or maybe now they've changed. I
Mhm.
think it's okay to let those decisions change over time.
Of course. It's only natural. As your disease, it's easy for people to say, right here, right now, I want nothing done. Until we're faced with our own mortality, it's only natural to maybe have changes and be accepting of the changes. As a healthcare surrogate, it's very important to be accepting and loving because they're going through such a horrific process of losing their identity slowly. It's so important for them to have that support of their family.
I think the surrogate needs to be supportive and encouraging, but voice acceptance of the choices of the
Mhm.
patient.
Oh, absolutely.
Yeah. And then I like what you said about being strong,
Hmm.
because the surrogate needs to be strong.
Yeah, our healthcare system is very complex, right? When you say, I mean,
Yeah.
we're kind of spoiled because we're doctors. We went through the training. We know we're physicians. We know the medical jargon. We know when someone places that call to us, right? And we're like, oh no, that's not good, right? We know it, but the general public does not. And unfortunately, there's a lot of medical systems that do not take the time to explain it.
Right. So today we wanted to review the importance of healthcare surrogacy, what it means and what it is. Do you want to sum up a little bit about healthcare surrogacy?
Yeah, so basically, what healthcare surrogacy means is every person should have a healthcare surrogate. This is a person that you designate to be in charge of your health when you lack capacity, when you're no longer able to make decisions or lose capacity for mentally or physically. It can be anyway, and that person is you will designate will do all your decisions for you, and you want to make sure that you pick someone that is very well knowledgeable of your life and what you would like and how you would like to continue to keep living or allow yourself to die peacefully. And then that person, like I said earlier, really needs to be strong because they're going to be up against medical systems. And not everyone is like Dr. Bone and I who are comfortable with talking about this.
That concludes our education for today. Thank you very much.
Thank you for watching.